Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Girithar. Each week we will focus on a caregiving issue in the form of a short educational video. Today we will discuss mental illness. According to the National Alliance on Mental Illness, this condition impacts a person's thinking, feeling, or mood and may affect his or her ability to relate to others and function on a daily basis. Types of mental illness include anxiety disorders, bipolar disorders, depression, schizophrenia, and obsessive compulsive disorders, among others, according to Mayo Clinic. According to the National Alliance on Mental Illness, 1 in 5 adults experiences a mental health condition every year. 1 in 20 lives with a serious mental condition such as schizophrenia or bipolar disorder. 50% of mental health conditions begin by the age of 14 and 75% by the age of 24. Signs and symptoms vary from person to person depending on the kind of condition and circumstances. These symptoms affect emotions, thoughts, and behaviors. Some of the primary symptoms include feeling sad, excessive worrying, or extreme feelings of guilt, withdrawing from friends and social interactions, experiencing extreme fatigue, or problems sleeping are some other symptoms. Alcohol or drug abuse, lack of interest in eating, excessive anger, and suicidal thinking are additional symptoms. Sometimes symptoms of a mental health condition appear in the form of physical problems such as stomach pain, back pain, or headaches. Mental illnesses are thought to be caused by a combination of genetic and environmental factors. Mental illness is more common in people whose family members have this condition. Certain genes increase your risk of developing a mental illness, and a life situation may trigger it. When it comes to environmental exposures before birth, environmental stressors, toxins, alcohols, or drugs while the baby is in the womb can cause this condition. Finally, brain chemistry is the final factor. Neurotransmitters are naturally occurring brain chemicals that carry signals to other parts of your brain and body. When the neural networks involving these chemicals are affected, the function of nerve receptors and nerve systems change, leading to depression, according to Mayo Clinic. Diagnosis is possible by a physical exam, lab test, and a psychological evaluation. Your doctor will try to rule out physical problems and also check for thyroid functions or screening for alcohol and drugs. A mental health provider can talk to you about your symptoms and thoughts, and you may be asked to fill out a questionnaire to help answer these questions. If your loved one shows signs of mental illness, it is best to have an open and honest conversation with him or her. It is also helpful to help find a qualified mental health provider and make an appointment on behalf of your loved one. If you feel your loved one is possible of it can harm himself or herself and is considering doing so, it is best to take the person to the hospital or call for emergency help. May is National Mental Health Awareness Month. Recovery is possible, especially when you start treatment early and play a strong role in your own recovery process. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.